Hello and welcome to the latest Insights Live Preparing for Healthcare in Retirement. I'm Susie Allen, Vice President of Insights from Fidelity Wealth Management. Thank you for joining us and submitting questions. Your questions really help shape our discussion. So today we will cover everything from health savings accounts, long-term care strategies, Medicare coverage, and more. This is an important topic with a lot to cover, so let's dive right in. But before we get going, please know Fidelity does not give tax or legal advice, and nothing we discuss today should be interpreted as tax or legal advice. The information we are providing is going to be general in nature, and it may not apply to your situation. If you have legal or tax questions about your specific situation, we encourage you to talk to your attorney or tax professional. All right, to kick us off, let's introduce the fantastic team of Fidelity professionals who are here with us today. I'll ask them to introduce themselves and briefly describe their role. So Chris, let's start with you.
All right. Thank you, Susie. My name is Chris Dodd. I'm a vice president and financial consultant based out of Houston, but I've got clients that do work or live all around the country. I've been at Fidelity for over 25 years, helping clients plan and invest for all phases of life, including healthcare. I'm a certified equity professional and a certified financial planner.
Sarah.
Hi, Susie, and hi, everyone. Excited to be here today. I'm Sarah Haflett. I am a vice president at Fidelity and coming to you from Pennsylvania. I co-lead our Fidelity Health Thought Leadership team, and our team is very focused on developing original research and insights and publishing reports that help people make smarter decisions regarding their health benefits and managing their healthcare costs.
My name is Jason Webb. I am a regional vice president with Fidelity's insurance agency. I am a certified financial planner with over 17 years of experience here at Fidelity, helping clients and advisors create and implement retirement plans.
Well, Chris, you work with clients every day to help them create retirement plans. How do you plan for healthcare costs as a part of that?
Yeah, great question, Susie. Like anything else, first step is try to gather as much information as you can. First question is going to be, what benefits are you eligible for? A lot of companies do have retiree health plans, but if not, there are other avenues such as COBRA, which we'll talk about later, retiree reimbursement accounts, which are slightly different than health savings accounts. Some people do have veterans, government benefits, Medicare, Medicaid, or if they don't have those options, maybe they're self-funding and using healthcare.gov to bridge the gap to Medicare. So the first step is just gather the information. What do we have available? Second, we'd like to find out, who are you covering? Are you single, married? Do you have children that are under the age of 26 or children with disabilities? That can all dictate what eligibility you have and what plans are available to you, but also what cost can we expect? So the first two things, just figuring that out. Location, another area of concern is cost of insurance, cost of medical care is different in Houston than it may be in New York. So where are you going to be living in early retirement, later in retirement? That can all drive healthcare costs, whether it be for just general healthcare, long-term care, just location. Where do you live? And right now, budgeting is not the biggest concern for most folks when they're paying for it just based through payroll deductions. It's nothing out of pocket in a lot of cases. It just comes from your paycheck, so you don't see it. It's not a real expense. It is there, but kind of in the back of your mind. But in retirement, it comes to the forefront. You have to pay those either via direct debit from your bank account, write a check, or it's deducted automatically from benefits like pension, Social Security. And once we have all that information, all those details we use from a planning standpoint, I live and breathe almost every day in Fidelity's Planning and Guidance Center. Those that have access to their accounts and online access have access to it themselves. So you can use that information on your own or with us as an advisor. And we'll cover a lot of these topics during our time today.
I'm looking forward to it. Well, how can someone go about estimating the costs of healthcare throughout retirement years? Sarah, can you help us here?
Sure. Many people are very unaware of what they will have to pay for healthcare in retirement. And unfortunately, spoiler alert, Medicare doesn't pay for everything. And many people think that once they get to Medicare age, everything will be taken care of, but that's just not the case. And so it's really important to understand, what you might be expecting to spend. on your healthcare outside of Medicare during retirement. It's very difficult for the average person to estimate what they're going to need, but fortunately here at Fidelity, we have a team that publishes an estimate of retirement costs in retirement healthcare costs each year. This year's was just released and revealed that a 65-year-old retiring today in 2025 can expect to spend on average $172,500 on healthcare and medical expenses throughout retirement. So big ticket item here. This is beyond what Medicare pays for. And it doesn't include long-term care expenses such as nursing home care or assisted living care or home health care. These costs could be higher for women because women tend to live longer than men do. If we just kind of think about putting that number into a little bit of context, breaking it down, so that $172,500 kind of breaks down into medical expenses like co-payments and co-insurance, deductibles for doctor visits and hospital visits, also Medicare Part B and Part D premiums, and we're going to talk about that a little bit later. And then finally, out-of-pocket prescription drug costs. So that's kind of the makeup of that number. When we surveyed, did our research and surveyed consumers to understand what they expect to pay for healthcare in retirement, we found that about 2/3 of workers over the age of 55 thought that they would spend about $75,000 in retirement on healthcare. So that's a gap of nearly $100,000 between what today's workers are expecting to pay in retirement and what they actually might experience when they retire.
Wow. Well, Sarah mentioned that Fidelity's estimate doesn't include long-term care. So, Jason, what should people know about long-term care costs?
Yeah, so I'm glad you bring that up, Susie. And it is important to understand that long-term care costs are not included in that survey. When I do think about long-term care costs, there are a few things I want to make sure that people understand. Number one is that long-term care events are more common than most people think. Statistically speaking, for a person turning 65 today, there's almost a 70% chance of needing some type of long-term care. We also know that the average length of long-term care services is approximately 3 years, with around 20% of individuals needing care 5 years or longer, especially those suffering from cognitive impairments like Alzheimer's or other cases of dementia. The cost of long-term care, number two, is the cost of long-term care continues to rise. So as you can see here, based on the Genworth study from 2023, their cost of care survey, we have seen the cost of long-term care rise anywhere from 79% to 123% over the last 19 years, depending on where a person receives care. Now, considering there's 11,000 Americans turning 65 every day, the chances are those costs will continue to rise. A third point I would like to highlight is that all those social programs like Medicare may provide short-term coverage to help with things like post-hospital recovery. They are not designed to cover long-term care expenses. So based on this, many families often end up having to shoulder the burden of covering these expenses, which can lead to emotional, physical, and financial strains. The good news is that individuals and families can plan ahead to help address these costs.
So now that we've unpacked the concerns, let's talk strategies. We'll start with Medicare. We get a lot of questions from clients about this program. So Sarah, can you walk us through the basics of Medicare coverage?
Sure, and you're right, Susie. So many questions about this because it is actually pretty complicated. There are a lot of moving parts and a lot of decisions to make. The Medicare enrollment process can be really confusing, especially when we think about what we're used to, with our employers and getting our insurance through our employer-sponsored health plans, where we may have one or two or maybe three choices that our employer has already narrowed down for us, done all of that research for us and narrowed it down to what they believe are the best selections for us. Now, let's look at going into Medicare and that process for choosing a plan. People can have dozens of plans to choose from when they're enrolling in Medicare. And people are largely on their own to decide what plan is best for them. So they don't have anybody kind of curating that list of many, many plans for them. Many people also don't realize how Medicare coverage works and how many different ways there are. to obtain coverage. We found that in our research, 40% of Medicare enrollees that we surveyed said it was difficult for them to select a plan. So we can talk a little bit about the basics of Medicare and all of the different parts that make up Medicare. Each of these parts provide a different type of healthcare coverage. So it's really no wonder people can get confused pretty quickly. So we have original Medicare, which includes both Part A and Part B. Those plans are administered by the federal government. You can enroll in Part A at the same time as Part B, or you can enroll in them separately. Part A is, think about your hospital insurance. Most people don't pay the Part A premium because we have been paying into Medicare through our Medicare taxes while we've been working. Part B, on the other hand, which is our medical insurance, the medical insurance component of Medicare, covers medically necessary services and preventive services. So think about your outpatient services, doctor visits, maybe some labs. Almost everyone pays the Part B premium. So thinking about those two parts as original Medicare. Part A and Part B also have deductibles. So that's the amount that you have to pay before your insurance starts to cover your services. They also have co-insurance, and there's also no limit on what a person can pay out of pocket in a given year, if that's the only coverage you have. Original Medicare pays for about 80% of the cost of covered services, and it doesn't cover most prescription drugs or other benefits such as vision, dental, or hearing services.
I want to follow up on that point about coverage. It sounds like Medicare on its own doesn't cover what many people may be used to with a private healthcare plan. So are there options to get more complete coverage?
There are, and many people choose to buy additional Medicare insurance to pay for what the original Medicare doesn't cover, so Part A and Part A and Part B. There are a few different options. So some people choose a Medicare supplement plan, also known as a Medigap plan, and or a Part D prescription drug plan, which is exactly how it covers your prescription drugs. Others choose a third option, which is called a Medicare Advantage plan, and this is also known as Medicare Part C. So a lot of acronyms and a lot of letters here when it comes to Medicare and understanding the different plans and coverage. If we look at Medicare supplement plans, those are the types of plans that are going to help you pay your share of healthcare costs, such as co-pays, the co-insurance, the deductibles that I was talking about before. Part D, prescription drug plans help you pay for medications you buy from your pharmacy or through a mail order pharmacy service. And then Medicare Advantage, so this is that Part C, those plans are sometimes referred to as an all-in-one option. They actually combine original Medicare services with benefits like vision, dental, and hearing, and potentially prescription drug coverage as well. These plans sometimes are desirable for people because they actually come with a pretty low premium, sometimes as low as $0. But there are some restrictions on which doctors you can see and within a certain geographic area.
That was a very comprehensive overview. Appreciate it. And now that we've explained coverage, what can you expect to pay for your Medicare plan? Chris, let's hear from you.
Sure. As Sarah mentioned, most people don't have to pay for Part A, but there are some caveats to that. Part A is free for those that paid into Social Security, but if you work less than 40 quarters, basically 10 years, there is a cost to Part A, and it can be as much as $500 per month. But as long as you had a spouse that worked those quarters or you worked those quarters, Part A is free. Part B, though, has a baseline cost and then an escalator cost. And one of the other acronyms we get into with Medicare is IRMA, Income-Related Medicare Adjustment Amount. And think of that as the extra amount you have to pay because you have too much income. The baseline cost is $185 per month, and that's adjusted each year with inflation. Inflation numbers come out usually in the October-November timeframe from the government. That IRMA amount, at $185, depending on your income, it can double or triple the cost of coverage for each person if your modified adjusted gross income is over a certain threshold. So think of $185 times 2 for a couple. It could be $500 times 2 for a couple if you go above those IRMA thresholds. What goes into modified adjusted gross income? All forms of income. It can be IRA withdrawals, dividends and capital gains, the tax-free portion of Social Security, even tax-free income from municipal bonds. And IRMA does have a 2-year look back, meaning your premiums are based on your income from 2 years ago, not maybe the income you're going to have in retirement. So there is a reprieve if you do have a life-changing event, work stoppage, spouse passes away, marriage, something changes that is a life-changing event. You can basically petition Social Security and Medicare to not look back 2 years because of that event. You can fill out a form called Social Security Form 44. It's on the Social Security website along with Medicare, but if you have questions, talk to an accountant, financial professional, if you have specific questions on your situation. And Part D also is subject to IRMA and that same Social Security Form 44. So again, if there's life-changing events, it's important to keep that in mind. If not, you're paying higher premiums for several years when you don't need to. After those basic coverage, then, like Sarah said, there are supplemental or advantage plans or retiree medical plans that also need to be included. So very quickly, we start adding up those numbers. It could be $1,000, $1,200 a month for a couple. That $172,500 we mentioned earlier, that can get used up over a 10, 20, 30-year period of retirement. And for those that are approaching Medicare age, if you're 64 years of age or older, Fidelity does have a Medicare services group able to analyze your current situation, look at available options out there, help you research, help you educate on what choices and what options are available. So I encourage a lot of our clients to use that service, schedule an appointment, talk to somebody, ask some questions.
Excellent. So you mentioned a life-changing event, and assuming you don't have a life-changing event, are there any strategies to help avoid IRMA?
There are a few options. I mentioned a few in the last question. Mitigating your taxable income, trying to get that modified adjusted gross income below whatever that threshold is for your filing status, single or married. And again, that number changes each year. So a few ways that you can mitigate. Consider taking a tax loss in your non-retirement accounts. What does that mean? Sell something that hasn't made money, a loser, right? A tax loss out there. You can write off up to $3,000 a year against ordinary income in losses, or you can match up unlimited losses against unlimited capital gains if you want to match that up against a winning position in your portfolio. So tax loss harvesting, end of year planning becomes very important. Along with those positions that are in your account that we look at, that you have some triggers you could buy and sell whenever you want. Some investments, like mutual funds, are forced to pay out capital gain distributions at the end of each year. So if there is a mutual fund that has a high turnover or they have a very good year, they have to pay out their capital gains. Usually it comes end of year, November, December, but it's good to know if you have an estimate of something big coming, how can you offset that? Fidelity's resources, our webpage, towards the end of the year will give you estimates and updates that we can help you with. Other financial firms may do that as well, but trying to get a gauge of what your end of year tax situation is going to be allows you to make some decisions earlier in the year. The other impact, I mentioned tax-free interest goes into the IRMA calculation. Municipal bonds, municipal money markets, yes, they go towards the calculation, but they're usually at a lower rate, meaning you're getting a lesser amount paid to you each month or each year. So that's going to have a lesser impact, but you're also not paying federal tax, maybe not even paying state income tax on it. So it's anything we can do to lessen the total dollars that goes towards that IRMA calculation. Some other timing considerations we look at is towards the end of the year, if you don't necessarily need to take money out of a 401k or IRA, a taxable investment, do you delay that until the following year? Or if you're going to have a bonus payment, something that's big from retirement, a severance, something that's going to come in that's extraordinary, try to plan around that and either push it to the next year or delay doing some other things in that big tax year. And for those that are over the age of 70 and a half, or those that are of minimum distribution age, which is now age 73 or 75, you can do a charitable distribution from an IRA account. And that's just a tax-free withdrawal from an IRA. That doesn't go towards the IRMA calculations, but it's a way for you to satisfy those minimums that you have to take out. And for those that aren't 70 and a half, or if you want to try to increase your itemized tax deductions, the One Big Beautiful Bill added some additional considerations for standard versus itemized deductions, but a lot of clients do bunch charitable gifts, meaning maybe you do a bigger charitable gift in one year, and a lesser in 2 or 3 years after that. You're trying to get a big tax break in 1 year and not as much in future years. So those are a few ways to help soften the blow.
All right, great considerations, Chris. Well, between costs and coverage, there's clearly a lot to take into account in choosing a Medicare plan. Sarah, can you help us understand some of the factors to consider?
Susie, there are a lot of roads to Medicare, a lot of different, ways that Medicare, the whole Medicare enrollment process can play out. And a person's path to Medicare is largely dictated by two main factors: age and working status. Generally, it's these two factors that will determine what types of coverage are available and the timing of their enrollment. So someone who retires before the age of 65 is in a completely different situation from someone who is 67 and still working. So let's just maybe talk a little bit about those who are continuing working past 65. For those individuals, if there is an individual working past the age of 65 who wishes to remain on their employer-sponsored insurance, there's some things to take into consideration here. These individuals must make sure that their employer coverage meets certain requirements so that they can make sure that they can delay Medicare enrollment without having to pay a penalty. These requirements are called creditable coverage, and the rules can differ based on the number of employees an employer has. So, really important to actually get in touch with your employer to understand that. Creditable coverage actually just means that the coverage that your employer is offering is and it will actually pay on average as much as Medicare would. Drug coverage also must be creditable coverage. For those who are working past their 65th birthday, there is a special enrollment period up to 8 months after your employer coverage ends to enroll in Medicare Parts A and Part B. So important to keep that in mind. You've got an 8-month window if you're working past the age of 65 and then transitioning to Medicare. Generally, even a retired person who has access to retiree health benefits through their employer must enroll in Medicare Part A and Part B to avoid late enrollment penalties and gaps in coverage. And that's something that, some people might think, oh, my employer offers a retiree health benefit, I can use that. Well, they actually also must enroll in Medicare Part A and Part B. So, this transition of care between an employer plan and a Medicare plan may also leave some gaps in the benefits that an individual might have been used to from their employer, like dental, which we talked about before, vision, but even things like gym memberships and nutrition services and counseling and programs that might help with mental health that a lot of employers have invested in over the last few years, especially mental health apps, virtual care. Those types of benefits and services are not going to be available through original Medicare plans. There are certain Medicare Advantage plans that do cover those types of benefits that many workers have really gotten used to having through their employer insurance and supplemental benefits. But not everyone wants to go with Medicare Advantage. And if an individual does not want to enroll in a Medicare Advantage plan, then they also always have the option of enrolling in standalone plans for dental services and care, vision, and some of those other supplemental benefits that I mentioned. So there are, as you can see, a lot of ins and outs. And I would say my advice is if you're still enrolled in an employer group health plan and you're coming upon Medicare eligibility, just consider checking with your employer or your benefits administrator so you can understand what you need to consider for your specific situation.
Really good considerations there. So now on the flip side, Chris, if you retire before Medicare age and are no longer eligible for employer healthcare coverage, what are some of your options?
Yeah, good question, Susie, because not everybody makes it to 65, right? Whether it be a downsizing, a severance, a voluntary, or a health event may cause you to retire before 65. So before 65, first thing I look at is, do you have access to your employer's plan as a retiree? And a lot of companies have a certain age requirement you have to get to. Sometimes it's 50, sometimes it's 55 or 60, and sometimes it is 65. But if you're eligible to retire at a certain age and still get coverage, we call that bridging the gap to Medicare. So educate yourself, try to find out what options are available within your company. Talk with your benefits team or look for a summary plan description. That's a term for pretty much any healthcare retirement plan. A summary plan description is available that basically outlines all of the details. You'll typically see it during open enrollment, but you can also go to your employer benefits website and find it as well. If your company doesn't provide retiree options for Medicare, or excuse me, for medical in retirement, a lot of companies have access to COBRA, which is a government program, stands for Consolidated Omnibus Budget Reconciliation Act. Basically means your employer will help you bridge a gap of up to 18 months, but it's usually at a much higher cost. It's not going to be the same cost you were paying as an active employee. So usually it's a stopgap measure, but it gives you some time to think and learn about what your options are. The other thing to think about is look at a spouse or partner's employer health plan, those life-changing events I mentioned earlier. When you leave employment, you may be able to jump on to another company or excuse me, another plan during the outside of the open enrollment window. So basically that life-changing event allows you to enroll before the next annual cycle. So again, reading through that documentation becomes very important. Check with benefits, check with the group health plan options that are out there. And if all else fails, the next step is the marketplace. Healthcare.gov, the ACA marketplace, allows access to coverage, may not be at the same cost, maybe a higher cost, but could be a lower cost. There are some subsidies out there. And the recent passage of the One Big Beautiful Bill does extend coverage of these plans and make more eligible. Think of the Olympics, bronze, silver, gold. There's different types of healthcare plans that are out there. So having more plans available is a good thing. And we'll talk a little bit more on that.
Well, clearly, even in the best case scenario, healthcare retirement is a significant expense. Jason, can you explain how a health savings account can help?
Yeah, absolutely. So for those that are eligible, health savings accounts can offer many benefits to help with addressing healthcare costs in retirement. These type accounts provide what we refer to as a triple tax advantage way to save for healthcare costs. First, the contributions allow you to reduce your income in the year you contribute. Second, the assets can be invested and grow federally tax deferred. And third, any withdrawals used for qualified medical expenses are tax-free. Health savings accounts can be a great way to help pay for future Medicare premiums, co-pays, deductibles, and prescription costs, as well as qualified long-term care premiums up to the IRS limits based on age. Now, it is important to note that Medicare supplement or Medigap premiums are not considered a qualified medical expense, so distributions from your HSA to pay for those premiums would not be tax-free. One last piece that I like to highlight, especially with us talking about Medicare today, is that if contributing to an HSA, a health savings account, and approaching Medicare enrollment, it is important to coordinate your final contributions before the start of Medicare coverage. This is another area people should review or consult with an advisor to avoid potential tax penalties.
Great, very helpful. So what do clients need to know about health savings account eligibility, which was just expanded in the most recent tax law? Sarah, can you help us here?
Sure, I definitely can. And I would say that, health savings accounts tend to have a lot of misconceptions, surrounding them. And we'll try to go through a couple of those right now. But, what we have found is that the health savings account can be one of the, most valuable tools to use in retirement, but it's often overlooked as a retirement planning tool. So, a lot of people don't understand that it can be used for healthcare costs in retirement. They think maybe it's just, for today's healthcare expenses, which it certainly can be used on, but it's also a great way to save for those expenses in retirement. But another reason is that in order to contribute to an HSA, you have to be enrolled in a high deductible health plan where you have to cover all of your costs up to the deductible before the insurance starts paying. And having a high deductible, just that term, can turn a lot of people away, even though this type of plan can actually be the better overall choice for many people because it comes with a lower premium and the ability to have the HSA to start contributing dollars to, as Jason was describing. Also, another kind of aspect of the HSA that not a lot of people know about is that
you own your HSA. So if you have an HSA, it is yours and it goes with you wherever you go. So even when you are no longer in a high deductible health plan, or if you change jobs, or if you retire, while you can't continue to contribute to the HSA, it's still your money to invest and use on healthcare costs.
Love the demystifying of HSAs here. So, what are strategies to make the best use of your health savings account in retirement? Chris, help us.
Yeah, this gets into the what ifs, right? A lot of clients ask me, Chris, should I be using this while I'm working, while I'm younger, before retirement, or should I let it sit there and grow, kind of like a 401k or IRA, and use it in retirement when I may need it more? So the first thing I always look at is situation, right? If you're a younger person, single, maybe a newlywed couple having a child, you may need that health savings account now versus later, and that's the priority. Is you're trying to get maybe a contribution from your company. A lot of companies put a base amount into a health savings account, and then you're putting some additional pre-tax money in and taking it tax-free, right? So situational use may be an important, factor there. If somebody's older, doesn't need it right now, or they're in their high income years, they may truly want to save it for retirement and let it grow, and it could be some combination approach out there. The other thing I look at is, do you have, I mentioned earlier, a retiree reimbursement account, something that your company provides? Usually that's the first pool of funds we may want to look at using, because that may not be able to pass on to beneficiaries, maybe a spouse, but not to children. HSAs do have beneficiaries, and we'll get into some strategies there as well about timing of use. And if you're married or over the age of 55, you can make a family contribution to one HSA account. There's some complexities with catch-up contributions and who has to set up an account first, but those withdrawals are tax-free if used for the current year or previous year's qualified expenses. I don't think most people realize that, but if you didn't take a withdrawal 2, 3, 5 years ago, but you had an expense that qualified while you were in a high deductible plan, you can take a lump sum withdrawal and it's still tax-free. So there are some nuances there on timing of use. And we speak about timing after the age of 65. Withdrawals don't have to be used for healthcare. They can be used for non-medical reasons, but they would be subject to income tax. So if you do end up building up an HSA account and you need some funds, think of it almost like a pre-tax 401k or IRA. And I mentioned earlier beneficiary use of HSAs. Spouses can pass that on and still receive the tax-free benefit with withdrawals for healthcare costs. But if it passes to someone else, a child, another family member, non-spousal beneficiaries, regardless of use, have to pay tax on that. So one of the strategies I talk with clients when it comes to, unfortunately, end-of-life care, or we had a huge medical expense, is, does it make sense to cash that HSA out tax-free because you had a qualifying expense, or pass it on to a family member and now they're stuck with the tax burden? And then make sure these accounts have beneficiaries listed. I see that missed quite a bit. That's not just for HSAs. That's just a general update, which we'll talk more on. But beneficiaries pass outside of a will. So making sure you've got an HSA account with a beneficiary listed and who that beneficiary is important. And if you do job switch, move from job to job, and you have multiple HSA accounts, consider consolidating them. Fidelity, and myself, I help folks move HSA accounts from other providers just for simplicity, make it easier, have it in one place.
Really important to underscore the beneficiary piece. Thank you, Chris. Jason, you had talked about long-term care earlier. So let's talk a bit more about long-term care insurance. What are the options for covering that cost?
Yeah, I appreciate the question. So essentially, there are 4 different ways to pay for long-term care. So first is personal savings, then government assistance, followed by traditional long-term care insurance, or what we call hybrid long-term care insurance, which offers life insurance with a long-term care option. So let's break each of those down, because I think it is important to understand each. So personal savings being the first one of the benefits to that is that your personal savings, it can provide flexibility and growth, but it can put a heavy strain on a family's financial wealth. So this option really should only be considered if you have substantial savings. Now, government assistance, there are federal programs that may help cover limited long-term care expenses. So for example, Medicare, which is not designed to cover long-term care services, may cover some limited benefits if they are part of the recovery process. Medicaid, on the other hand, may help low-income individuals, but that is only once a person meets eligibility requirements, which is typically after the person has exhausted their assets. TRICARE, similar to Medicare, provides limited benefits for uniformed service members, retirees, and their families, but also for veterans, there may be some assistance through the VA. On the insurance side of this, so we do have what we call traditional long-term care policies. These were commonly used types of long-term care insurance. They offer a high degree of personalization, allowing a person to choose things like their monthly payment, how long it lasts, how long they'd have to wait before receiving the benefits. However, many insurance companies no longer offer traditional policies, and those that do may raise annual premiums after purchase. An additional consideration is that many of these policies are use it or lose it, meaning that if you never need long-term care services, you don't receive any benefits. The fourth option, which is a common alternative to the traditional long-term care, are the hybrid policies. These are insurance policies that combine long-term care coverage with life insurance benefits. A hybrid policy allows people to use a portion of their savings to create a leverage pool of long-term care benefits that they can access on a monthly basis to help pay for long-term care expenses. But if you don't use the long-term care benefits, it will pay a life insurance death benefit to your beneficiaries upon death. An additional benefit of hybrid policies is that you may receive a concierge service, which helps with things like care coordination. Hybrid long-term care policies have continued to grow in popularity, and they're actually what we offer here at Fidelity. Now, which option is ultimately going to be most suitable for a client is really going to depend on his or her overall situation.
All right. Great overview. Thank you for that. Now, for clients interested in the long-term care insurance option, when should that process start?
Yeah, I can't emphasize this enough up front, which is that it's never too early to start planning for long-term care. So I have personal experience with this with a family member who suffered from a cognitive impairment. So I know exactly what this looks like. And one of the things I often tell people is it's never too early to start planning. Now, the younger you are, typically the less it's going to cost to have the coverage. In my experience, people typically buy long-term care insurance when they're in their 50s. At this stage of life, it tends to be more affordable, and you're less likely to have any type of medical issues that might potentially disqualify you from purchasing a policy. Now, this does not mean that people cannot explore long-term care coverage earlier or later in life. When I think about the process of exploring long-term care, we try to simplify it here at Fidelity. And it starts with a very simple, but what we consider to be an extremely impactful conversation with an advisor and with a family member. What we're looking to understand are the answers to really three questions. Number one is simply who? Who is going to take care of you? More importantly, have you had the conversation with that person? Taking that even a step further, does that person even live by you? Do they have experience with providing care? So there's a lot of questions that we try to unpack with that. The second question we want to understand is where? Where do you want to be taken care of? Is it in home, through a homemaker services? Is it any type of assisted living or nursing home? Once you understand that, it really boils down then to the how. How do you plan to cover that cost? Now, once we understand your thoughts and your wishes, we can actually partner with one of our dedicated long-term care specialists that we have here at Fidelity to explore those options in more detail.
Simple questions, but really meaningful conversation. Just to expand on this a bit more, what factors can influence the cost of a long-term care insurance policy?
Yeah, so there's a variety of factors that can impact the cost of long-term care insurance. And we touched on one a moment ago, which is age, right? That the younger you are, the more cost-effective that it tends to be for the plan. Health can be another factor. So you do go through an underwriting process. So health factors will be evaluated to determine if the applicant is classified as preferred or standard, which can have an impact on premiums. Gender can have an impact as well. A single or a joint contract. What I tend to find in my day-to-day is not a lot of people are familiar with the fact that we can do some of these policies as a joint contract. So whether it's a single or joint contract between spouses, that can absolutely have an impact on it as well. And then policy features tends to be a big one, right? So this is going to be things such as like, what do you want to receive as your monthly benefit? What's the elimination period? So that's the time frame from when you have the onset of needing the long-term care to when the benefits start. And then do you want to have a COLA or a cost of living adjustment attached to that? All of these are policy features that can impact the premium. The last thing that I would highlight here is just simply where a person lives can actually be a significant driver to consider. We actually have a very good viewpoint out there called long-term care options and considerations. And as part of that viewpoint, we have embedded in there a Genworth report that allows individuals to take a look at what the current long-term care costs would be in their area, as well as potentially what the future costs might look at. And this is all dependent on looking at where they live or their zip code. So where they're currently at, or potentially where they may plan to retire. Now, a link to that article and the study will be downloadable in the additional helpful resources that we have. But I would say those are the major factors that we look at when it comes to the impacts on the costs.
Jason, we'll let you off the hot seat for a minute here. Want to close the loop on what Chris brought up at the beginning of this webinar around non-financial healthcare considerations. So one common issue is caregiving. And Sarah, you and your team have done research on caregiving. What else do people need to know?
Yeah, Susie, we have. And I think, Jason talked a lot about the formal caregiving, right? The paid caregivers, once you potentially need long-term care services. But what about the unpaid caregiver, right? Which, really tends to happen quite often to individuals during retirement where, maybe one spouse becomes ill and the other becomes the really the day-to-day caregiver for that spouse. So these retirement, sometimes we don't think about these types of challenges in retirement when we're starting to prepare for retirement. But just to give a little bit of context in terms of what the data is saying and what the research is saying. So we found that a study by the National Council on Aging found that about a quarter of retired women are providing care for loved ones in retirement, and that women are significantly more likely than men to have caregiving responsibilities sort of overall. And we know certainly there are men who are, having to take on those responsibilities as well, but women tend to take on more of the burden of that in retirement. And obviously when someone is trying to balance their caregiving with other demands from family demands, community responsibilities, maybe they're doing some sort of work in retirement that is unpaid, something's bound to fall through the cracks. And most of the time what we find is that it's the caregiver's own health. So, not having the time or mental capacity to kind of keep up with healthy eating habits, exercise, taking care of their mental health, those kinds of things. The recent survey that we conducted found that a third of those who are caring for a loved one with special needs in retirement rated their mental health as fair, poor, or very poor. So about a third saying, I'm not in good mental health. And about a little over a quarter said the same about their physical health, that they were, not really feeling like they were in very good physical health. Could be as a result of not being able to have the time, kind of mental capacity to kind of take care of themselves while they're taking care of someone else in the household.
Really underscores the importance of self-care when you're a caregiver yourself. Now, related to caregiving, Chris, what do clients and family members need to think about or ensure that their loved ones understand and can execute their wishes later on in life?
Yeah, it's good communication. I hear good and bad stories from clients, and having a plan in place, we say it a lot, have it in place before an event happens. And it can be as simple as just a support network, friends, family, support organizations, having somebody there to help the caregiver because they need time alone too. Go to the gym, grocery shop, just go for a walk. They need some recovery, some mental health time. So, have that plan together if available for you. I encourage clients, look at the options available through support networks, that extended friends and family. Have some contingency plans set up. And sometimes that's in documentation, contingency plans. Know where those important documents are, power of attorneys, healthcare directives, wills. Here in Houston, we've had hurricanes and floods, and we've had people lose those hard copy documents, or a safe deposit box at the bank, floods. Those documents are gone. So have some contingency plans, some backup plans out there. Fidelity does have a great resource available under your documents and statements tab called FidSafe. Think of it like an electronic storage box out there. So fidsafe.com is the website, but you can get to it through your documents and statements section. And as you're reviewing some of those documents, power of attorneys, healthcare directives, they're great resources to speak for you when you can't speak for yourself, but I see a lot of those documents have just one line of defense. Usually it's the husband and wife. There's no backup plan. So if one spouse passes away or becomes incapacitated, or one power of attorney predeceases you or can't do it, there's no backup plan. So you may want to dust those documents off, review them, maybe have a secondary, tertiary plan, available out there. I talked to a client last week, widowed, 84 years old. He still had his wife listed as power of attorney and she's passed, right? So there is no plan right now. The courts will have to figure it out. There may need to be a guardian assigned. So don't let those things fall through the cracks. Try to get on top of it. I know it's tough when people are grieving and have had loss, but try to bounce back and get those things squared away before an event happens or shortly thereafter. And I mentioned earlier, make sure your intentions are there. Beneficiaries are the first line of defense, but wills, power of attorney documents, just spelling out what needs to occur and what needs to happen. And if you do have a long-term care policy, make sure those that are going to be utilizing that know how it works and know that you have it. And again, conversations. Family members need to know those details. Are they an executor in your will? It can help alleviate the stress. I do see a lot of clients that don't unveil the curtain. Basically, they don't share with the family members, and I'm usually the one having to share it after a life event. Certainly I can do that, but I think it's much more impactful when it comes from the family member. It can alleviate stress for that person when they are losing a loved one, but then also trying to figure things out. So depending on the situation, I'll invite children, family members. We'll do an in-person meeting, a Zoom call, but I encourage folks do that on your own as well. It's good to have a third party or a financial advisor there in your corner, but have those family conversations yourself.
Such power in having those family conversations for sure. Well, we have covered a lot of ground today, and I'd love for each of our panelists to share a few key takeaways to leave our viewers with. So, Jason, let's start with you, please.
Yeah, so it's been a great time today. So just two things I would leave our viewers with. So one is that Fidelity views healthcare expenses as one of the 5 key risks to retirement income security. It is extremely important to understand the impact of these healthcare costs and what they will have on your retirement plan. Additionally, planning ahead for long-term care, which is a separate cost, can help families manage the physical, financial, and emotional challenges that arise when a loved one requires these services to meet their needs of daily living.
Sarah.
Yeah, I would say don't be too quick to discount enrolling in a high deductible health plan that allows you to have a health savings account. For many people, this can be the most suitable option for them because it can help them save on healthcare costs, not only today, but use those funds, saved up funds in the HSA for healthcare and retirement. I think earlier Jason said it's never too early to start planning for long-term care. I would say it's never too late to contribute to a health savings account. Often we hear in our research that people who are kind of nearing retirement age, over the age of 55, just disregard them because they think they're not worth it. But they can be. There's still time to build up funds for retirement. And then finally, I would just say look for a Medicare advisor or broker who can provide you with easy comparisons, data-driven comparisons of different plans, their features, and also be able to provide you with greater personalization and curation of options that are available to you. And then really look for those who are really interested in offering you more of a neutral, educated, education on these plans and less of a sales pitch.
And Chris.
Yeah, we'll wrap it up here. Educate yourself on the options available. It's important, can never have too much information. We need it as advisors to help, folks out there understand what benefits are available. So, read through it yourself, and then that helps us help you out there. Communicate with the loved ones, let them know what your intentions are, get the proper documentation together. And if you need help, reach out. Myself, other financial advisors here at Fidelity, but attorneys, doctors, support organizations, reach out with questions before and during those health events.
Well, thank you, panelists. And we hope you, our viewers, will join us for part 2 of this discussion on preparing for healthcare costs in retirement on August 21st, where we'll take your questions live. In the meantime, if you have more questions about managing healthcare costs in retirement, please reach out to your Fidelity representative. And if you don't have a representative, visit fidelity.com/find an advisor. And for more timely market updates and insights on other financial planning topics, subscribe to Insights from Fidelity Wealth Management for exclusive invitations to future wealth management webinars and access to our weekly newsletter. Thank you so much for joining us.